How does Cardiovascular Risk Reduction USA, that is proactive cardiovascular risk prevention, measure cardiovascular risk? With advanced genetic and lipoprotein analyses at the appropriate time based upon family history and standard, basic, and advanced lipoprotein measurements. This recently enrolled Medicare patient who 10 years earlier had a history of symptomatic ischemic heart disease secondary to a severe dyslipidemia responded well to proactive care. His original total cholesterol was 350. In June of 2011, his total particle number was 716, placing him in the best 2% with regard to cardiovascular risk. His total cholesterol had been lowered to 117 with an LDL cholesterol of 45, HDL cholesterol of 56, and triglycerides of 73. His VLDL particle number and size indicated a slight residual from his dyslipidemia. He decided to stop one of his medications because of negative publicity, and his particle number went from the best 2% to the 23rd percentile. From his hemoglobin A1C and insulin level, could one determine if there was an insulin resistance problem? You are now looking at the most comprehensive cardiovascular risk factor report, which is the most informative and far superior to the regular lipid panel. This report assesses kidney function because people with poor kidney function have increased risk of cardiovascular events. Rarely, if ever, evaluated by providers, this profile ascertains if you are a hyperproducer or hyperabsorber of cholesterol. The Aspen Works test evaluates platelet hypercoagulability, which alone without any other risk factors can predispose to heart attacks. There are other genetic tests that analyze your response to the effectiveness of Plavix with regard to a poor response or increased bleeding, the possibility of developing thrombophlebitis on long trips, your metabolic response to Coumadin, your thyroid function test which influences cholesterol metabolism are also evaluated. Levels of vitamins possibly influencing cardiovascular disease and homocysteine are also measured. The potential for medication side effects or metabolic abnormalities is closely followed. Most important of all, it evaluates LDL, HDL, and VLDL particle number as well as size. It also evaluates if you are consuming the desirable amount of omega-3 fatty acids in your diet.